Big FM podcast.
You are listening I Believe in IVF, presented by Emcure Pharma, powered by Materna.
You're listening to 92.7 Big FM, and on the occasion of International Day of Girl Child 11th October, in the show we have Dr. Apoorva Pallam Reddy. She's a gynecologist and fertility specialist and laparoscopic surgeon from Apollo Cradle, Jayanagar and Phoenix Specialty Clinic, Jayanagar, Bangalore. Hello doctor, welcome to the show.
Thank you.
So doctor, may I ask about you? Where do you belong? Where did you study? And how is your experience working in IVF? And what are the unique services you offer to patients?
Thank you for having me. So, I'm born and brought up Andhra Inda, Nellore specifically, but 2004 ಅಲ್ಲಿ ದಾವಣಗೆರೆಗೆ UG ಮಾಡಕ್ಕೆ ಅಂದ್ರೆ MBBS ಜಾಯಿನ್ ಆಗಕ್ಕೆ ಬಂದಿದ್ವಿ. ಸೊ ಅವಾಗಿಂದ ಕರ್ನಾಟಕದಲ್ಲಿದ್ದೀನಿ. ಸೊ ಅದಕ್ಕೋಸ್ಕರ ಕನ್ನಡನೂ ಹೀಗೆ ಚೆನ್ನಾಗಿ ಬರುತ್ತೆ. And I've done my PG in Bangalore. So post graduation OBG ಆದಾದ್ಮೇಲೆ I've been to US, Malaysia, Germany, ಒಂದು 3-4 international countries ಹೋಗಿ especially IVF ಅಲ್ಲಿ or infertility related fellowships train ಮಾಡಿದ್ದೀನಿ.
So doctor, October 11th marks International Day of Girl Child Day. On this occasion, can you please explain us what is IVF?
So IVF andre in vitro fertilization, or now most commonly we call it as test tube baby anta ಹೇಳ್ತೀವಿ. So test tube baby allinu there are two types. One is IVF and the other is ICSI. Without too much of confusion, ಈಗ pregnancy ಆಗ್ಬೇಕಂದ್ರೆ sperm and egg fertilize ಆಗ್ಬೇಕು. ವೈಫ್ ಕಡೆಯಿಂದ ಎಗ್ ಬರಬೇಕು, ಹಸ್ಬೆಂಡ್ ಕಡೆಯಿಂದ ಸ್ಪರ್ಮ್ ಬರಬೇಕು. ಇದೆರಡು ಫರ್ಟಿಲೈಸ್ ಆದ್ರೆ that is when a pregnancy or a baby forms up. Now if this process happens inside the womb of the woman, inside her body, then that we call as the natural pregnancy. If you are doing it externally outside in a laboratory, that is when we call it as IVF or in vitro fertilization. The technique wherein we bring in the sperm and egg together, fertilize it, form an embryo, and ಈ embryona uterus ಒಳಗಡೆ ವಾಪಸ್ ಹಾಕ್ತೀವಿ. So from there the embryo will get implanted and the baby will start to grow.
So doctor, in IVF, have you ever come across a difficult patient whose demand is to have a male child, and how do you handle such scenario?
It is very sad actually. First of all, India dalli IVF acceptance is a little on the lower side because people feel that IVF is some big crime and that they shouldn't be doing it, or they feel that the baby will have some kind of abnormality and things like that. Ultimately, even if they do agree for an IVF, they have this notion that, okay, if you do an IVF, you can determine the sex of the baby, or you can have a choice of the sex for the baby. And, they ask, okay, you're anyway doing IVF, no. So please, help us have a male child. And people usually have different, explanations for it. Some say that it's because of their mother-in-law. Some say that, okay, ನಮ್ಮ ಫ್ಯಾಮಿಲಿಯಲ್ಲಿ ಎಲ್ಲರೂ ಹುಡುಗಿರೇ ಇದ್ದಾರೆ, ಸೊ ಅದಕ್ಕೋಸ್ಕರ ನಮ್ಗೆ ಒಬ್ರು ವಂಶೋದ್ಧಾರಕ ಬೇಕು. And they do have different weird reasons in order to have a male child. But we kind of insist and let them know in the very beginning itself that it is not something that we can do as a part of IVF, and definitely not here in India.
You being a fertility expert, can you please give a message on how to empower girls, especially in India?
I think mothers need to empower themselves first. They need to understand as young girls, they always kind of imbibe what they see from their mothers. So it is important for the mother to bring about that change in herself. Only then she will kind of start doing it for her daughter. That's definitely step one. And step two, I think, is education and financial independence. That is the only way where, women can feel empowered. I've seen a lot of women who are in bad marriages and, they still feel that they don't want to come out of it because they know that they can't financially rest themselves, and they don't want to become a burden on their parents. Of course, I have seen women who are, financially very independent, and nevertheless they continue to stay in bad marriages or, kind of get abused at different levels. So it's important to have both parameters changed. We need to empower them in an emotional manner wherein they feel that, they are not less than any other human being around them. And we also need to kind of financially empower them, make sure that they are educated to whatever extent that they want to, and they do have some amount of financial independence.
You were listening I Believe in IVF. It's not only a campaign but a movement.
Big FM Podcast.